This patient's labs we're about to go over that's been struggling with her transition into menopause has really been suffering with more hot flashes, more heart palpitations, and anxiety. On the other flip side, she also has lower depressive states and her libido is really low and she has joint pains and she has no idea why because her doctors wouldn't test her hormones. She also is complaining of belly, bloating, constipation. She has a history of fibrocystic breast and fibroids, and her blood pressure has been creeping up and staying high, once again, without a plan besides just more medications. Check out what we found with her labs. First things first, this patient's going to experience more anxiety and heart palpitations because her adrenals are on overdrive. Her cortisol is way higher than it should be. But at the same time, she's going to feel sluggish and lower libido because her fountain of youth DHEA is way lower than it should be. We also found the culprits for a lot of her stress and hormonal issues is because she's barely digesting any of her foods to get the essential nutrients she needs. She's dealing with a chronic inflammatory response from dysbiosis, as well as some infections that we need to clear. This poor pancreatic function was also contributing to disturbances with her blood sugar and sleep and adrenal response, believe it or not, when you have this low of pancreatic enzymes. She also has such a loss of beneficial bacteria that are there to protect her unless there's not enough, which there isn't, and she has all these overgrowths of bacteria like strep and candida and this fungal environment that's really throwing off her hormonal system further. And on top of that, she doesn't just have one parasitic infection, she has two different forms of parasitic infections. This is going to contribute to mental health disturbances, anxiety, heart palpitations especially. And she thought she was doing good eating healthy, but bananas showed up on her list, eggs, chia seeds, hemp seeds, and even tomatoes. So if you don't know what foods are causing you inflammation in the first place, this is the best place to start. So this patient was just ecstatic to be able to work with us virtually. We set up a game plan for her with her nutrition, an herbal regimen that worked really well for her as she's already seeing results with us just 4 months later. So please make sure if you have any questions about this approach, put a comment down below. We'd be happy to help you guys and set up a call with us to explain what testing can look like for you so we can send it out to you and then talk about a game plan, especially if your doctor hasn't tested your hormones or especially looked into your gut and your nutrition to find the culprits of hormonal imbalances in the first place.